Hi, everyone. Welcome to our CancerFITT education for the week. We are going to be talking about chemo brain today. That is the education topic. So remember, if you have your education booklet, looks like this. So we're going to be talking about that page that says chemo brain. It should be the page right after what we did last week, the aerobic exercise. So we're just going in order. So we're just talking about chemo brain today. So we'll just have some helpful hints. Remember, as always, if you have any questions on this education, make sure that you reach out. It should be straightforward information. Again, talking about chemo brain. So let me go ahead and share my screen so you can see the handout and I can go over it as we talk through it. Okay, so what you should be seeing on this screen is a handout or the handout in your education booklet for chemo brain. Let's talk about it. So it's called chemo brain. I always say I do not like the term chemo brain because people say, well, I didn't have chemo and I still have that brain fog. So it's the brain fog that people refer to when they're going through treatment. So it's called chemo brain, but it can be caused by cancer treatment, not just chemo, radiation, immunotherapy. It could be caused by all those things. But again, the more widely talked about term is chemo brain. So what is it? Again, it's the term patients and providers use to talk about the memory and concentration problems associated with cancer and cancer treatment. Um, a couple weeks ago we talked about fatigue. I also like to lump chemo brain or cancer brain in with fatigue because it is like a brain fog or brain fatigue, right? You can't remember things. So what are the symptoms? How do you know if you have it? How do you describe it? So it could be trouble remembering things. So, you could remember all the days of all the days that you had appointments, or you could remember everybody's birthday, but now it's not coming so easy. So that's one symptom. You can't stay focused. Remember, you used to can do a task and stay focused on it for hours. Now you feel like, you do it for a couple minutes and you just can't concentrate on it. So you can't find the right word or name. You can't remember, people's names, or you're thinking about a word, but you just can't get it out. You can't, it's hard to learn new things. You have trouble multitasking, so you only can really focus on one thing at a time. And it's taking longer to do simple activities. So things that used to be simple and easy now is taking you quite a bit amount of time. So those are some of the symptoms. And if you're sitting there and you're reading and you're like, you know what, I've had trouble with those things, then you may just be experiencing chemo or what I call cancer brain. So what are causes of it? And I know everyone wants to know exactly what is causing this problem that they're having, but honestly, it's not well known what causes chemo brain. So it could be chemotherapy, it could be radiation, but these are some of the things that can lead to it. Low blood counts. So if you have low blood counts, white blood cell counts, red blood cell counts, then that could be causing you to be tired, which may also be causing you to have that chemo brain fog, fatigue. Stress, depression, and anxiety. If you're going through a traumatic event and you've experienced stress, depression, anxiety, that will affect your brain. You won't be able to concentrate. You won't be able to remember things because you got so much going on mentally that you're trying to overcome. Fatigue itself. So just being tired. So sometimes when we're physically tired, we're mentally tired too. So not only is our body worn out, our brain is worn out. So we can't concentrate. So that tiredness leads into that chemo brain as well. So some of the medicines you may be on, hormone changes. So definitely if you have a hormone related cancer, such as prostate cancer or breast cancer or anything that's hormone related, that can cause that chemo brain. Other medical conditions. So I said it once, I'll say it again. Rarely are people who are diagnosed with cancer only have that cancer to deal with. A lot of times we're fighting other medical conditions as well, such as diabetes, high blood pressure. It could be, heart issues and things like that. So it could just be having other medical conditions. And then, of course, cancer cells. Cancer cells themselves can cause chemo brain, especially if you have brain tumors or brain cancer. Of course, if you have those cells in your brain, it's going to be hard to focus, to remember, because those cells are attacking your brain. So the big question is, what can you do? You've been experiencing these side effects. You think you've been experiencing them. How can you help? What can you do right now to help with this? So one thing, keep a memory journal. So I talk about the memory journal. I talk about a journal not only for this, but I talk about it for fatigue as well. So try to write down your thoughts, your ideas, anything that you have to remember, write it down. Don't rely on yourself, because you can't remember things anymore. So I know, we want to say, well, I'll remember it, I'll be fine, but don't take that chance. Write it down. Most people write down their doctor's appointments, but not only your doctor's appointments, anybody involved in your healthcare, write their name down. Write down important people's names, people's phone numbers, ideas, anything that you need to remember. Keep a journal and write it down. It always helps because you can always refer back to it. It's right there and you can read through it. So that's my number one thing if you want to help remember things. Try to keep a regular routine. So the more you change your routine, the more you change where you put things, that's going to be the hardest to remember them. So if you can remember, okay, I'm always going to put my keys in this spot, I'm always going to, put this here, then that can help greatly because once you develop a routine, it's always there. You don't have to look and search around for it. You have a specific spot that goes right along into decluttering your space. For me, when I have a cluttered space, my mind feels cluttered. It's almost directly related. So cleaning off things, decluttering, everything having their own special space and place helps you mentally. Not only does it help you, physically because you don't have a lot of things everywhere, it helps you mentally. You can kind of organize the things not only in your brain, but in your physical space as well. Try to divide a larger task into smaller ones. So we talked about this when dealing with physical fatigue. Don't try to say, I'm going to wash 10 loads of laundry, just watch one and take a break. Same thing with a mental task, a mental task. Say, if I don't know, something mentally that you can do is, maybe doing your taxes or something that you have to concentrate for. Just break it into a smaller task and then, take a break and then come back and do a little bit more. Don't try to do something physically all at once or mentally. Use a checklist. So if you have things that you have to do get done for the day, and you can't remember it, make sure it just goes back to having a journal. Write it down, make a list of all the things so that you don't have to remember it, and then check off the list as you go. That way, it kind of takes it out of your brain and it puts it on paper where you can see it. Repeat information aloud after someone gives it to you. So if somebody tells you their name, repeat that name back. If somebody tells you directions, try to repeat it back. If you can say it out loud, that helps ingrain it in your memory. But of course, that fails, write it down. That first one, write it down. Bring someone with you to any appointment. This goes for anyone, not just someone dealing with chemo brain. It always is helpful to have a second set of ears there. It helps reduce confusion. It helps you remember things that your healthcare provider has said. And also, if you had things that you wanted to tell your doctor or healthcare provider, that person can remember and tell them. So it always helps to have somebody there with you. You're going through a lot mentally, you're going through a lot physically, and it may just be really hard to remember everything that they're saying to you. So having somebody else there as well. The next, we're going to talk about exercise. So that's something great that we deal with in this program. So exercise your body and your mind. Um, so learning something new. So trying to learn something new. I know it may be a daunting task right now, but that helps get your brain going, kind of like word puzzles and word games and just puzzles. It's a mental workout, so you're using your brain. You're not just doing something mindless. You're keeping your brain physically active. I know there's like an app or a website, I want to say it's called Logic, that helps, but there's different programs out there that you can help with mental games. Staying physically active is one. I mean, physical activity helps clear your mind, helps get you going, helps get your blood flowing, and it helps you mentally as well. A lot of people use physical activity for a mental release. So that kind of helps clear your mind and helps you focus. Getting enough sleep, easier said than done, I know, but trying to sleep, the more you can sleep, you'll be less physically tired and mentally tired. If you're really having trouble sleeping, of course, you want to talk to your doctor. Maybe it's something they can help prescribe for you. In a couple more education lessons, we'll be doing a meditation topic. So that is another good thing that you can help with sleeping if you're having trouble sleeping at night. Eating healthy meals and drinking plenty of fluids. So that helps. The more you can be physically healthy, by what you put in to nourish your body and getting plenty of fluids, unless a doctor has told you otherwise, that's really going to help mentally as well. Train your focus and your concentration. So you can train your focus and concentration. So be realistic. We talked about this with fatigue. So set goals for the day that you can do. Do not load your plate with too many things that you can't complete. So you want to prioritize your day. Do the most important things first. So if you know there is something pressing that you have to go to the grocery store, then do that. If you do too much, that can overload not only your body, but your brain. They are interconnected. So you want to make sure that you be realistic and prioritize. Do not do a task when you are tired or hungry. If you try to do something mental while you're tired or hungry, that is the least likely you will be to succeed. Think about when you go to the grocery store and you're hungry. What do? You buy everything that's not healthy for you because you're hungry. So mentally, it's the same way. Don't do anything when you're tired or you're hungry because you're not going to be able to concentrate. That's just setting yourself up for failure. Try to do just one thing at a time. We talked about at the top about multitasking. Maybe you just don't multitask anymore. Maybe you can just focus on one thing. That's the more that you can kind of just train yourself to concentrate. Avoid distractions. Try to quiet your environment. If you know that you have to do something that you have to really focus on, turn the TV off, turn the music off, try to just focus on that one event. Plan breaks according to your concentration span. So if notice after about maybe 10 minutes, you get a little antsy and you can't concentrate, it's okay to take a break. Don't get frustrated with yourself. Take a break, walk away, you know, do something else mentally or do something that's going to help you mentally unwind and then go back to the task. Stand up and take a walk. That goes back to physical activity, just how physical activity can help, mentally. Standing up, taking a walk, if you're doing something seated, if you're standing, maybe sitting down, just having that change will help as well. And then this goes back to making that journal. Know what time of day or days you have the most energy and concentration. So Fridays at 5. If you know Fridays at 5, you've had a long week and you are tired. Do not plan to do something mentally that you're going to have to concentrate, and don't plan anything that you're going to have to physically do anything. You again are setting yourself up for failure. So you can make a journal, not only a physical fatigue journal, you can make a mental fatigue journal, and just notice the times of the day, the days of the week where mentally you just don't have any more to give, and then plan according to that. Um, so those are just a few things that you can do. If you have any questions on those, of course, when I give you a call, just let me know, ask me. And if you have anything that you do yourself and it's missing from this list, let me know so we can add it to it. It is always helpful to share your knowledge, share your experiences so that, I can share it with others or you can share it with others. The last little bit, we're going to talk about communication. So communication is definitely the key. Not only you communicating with your doctors and your healthcare providers, you communicating with your family and your caregivers. So your ones know that you're going through a cancer diagnosis. They know you're going through treatment. So let them know, say, hey, look, I could, do all these things. I could remember everybody's birthday and get them all gifts and do all this stuff. But now I'm different. I can't do it anymore. And if you are just honest and open, they're not going to be expecting things from you that you can't provide from them anymore, which leaves, you feeling frustrated and upset, and maybe them feeling that as well. So just be open and honest and say, look, mentally, I can't do it. Mentally, I can't remember these things anymore. You're going to have to help. So delegate, say, hey, I can't be in charge of the grandkids' birthdays anymore. I need you to help me on this, or I can't be in charge of this. I need you to help me. So as long as you let your caregivers, your family members know what you're going through, they can not only be sympathetic and understanding, but they can also help. Um, so if all else fails, if you're just like this chemo brain mentally, I really don't think it's getting better. It's really bad. And, I think I need help. Talk to a healthcare professional, talk to your oncologist, talk to your doctor and say, look, this is what's going on, because they may have other resources that may help. So, again, communication is key. Don't keep it all inside. Let your family members know, let your healthcare providers know. So that is pretty much it, chemo brain. I know I kind of simplified this very, very complicated topic, but if you just kind of follow some of those guidelines, that may help A lot of this information has come from the website cancercare.org. So if you want more in-depth detail, that website has a great source of information for all different topics dealing with a cancer diagnosis. So it's www.cancercare.org. That's where a lot of this information has come from, and they have a ton of other information as well. So I'm going to stop my share and come back to you. Sorry if I was leaving them their way. So if you have any questions, that's just chemo brain. Again, I hate to simplify a very complicated topic, but those are just some tips. Again, if you have any questions when I give you a call, just let me know if there's anything that you want to go over in detail or anything that you have questions about that I went. So all right, I will talk to you soon. And this has been our education topic for this week.